Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Toe pain causes links to heart diseases and treatment. Toe pain can happen for a few different reasons. It might be from temporary problems, like a broken toe or blisters, or due to long-term conditions like osteoarthritis or gout. Some health issues, like diabetes, can cause painful neuropathy, nerve damage, while heart problems can affect blood flow to the toes, leading to pain. /r/n/r/n treatment for toe pain depends on the underlying cause. It may involve medications, physical therapy, or in some cases surgery. If you experience persistent pain or swelling, or if you have a history of heart conditions, consult a healthcare provider for an evaluation. /r/n/r/nLightFieldStudios, Getty Images/r/n/r/n Toe pain can appear suddenly or develop gradually over time, depending on the cause. It may result from acute, temporary, issues like a fractured toe or blisters, or from chronic, long-term, conditions involving the heart, kidneys, or other organs. /r/n/r/n Acute problems that can cause toe pain include, /r/n/r/n turf toe. This sprain happens when the big toe bends too far backward during specific movements. It often results from a single sudden movement, but can be caused by repeated stress on the toe over time. The pain may be most noticeable when lifting the big toe, standing on tiptoes, or pushing off to run or jump. /r/n/r/n toe fracture, a broken bone, fracture, can occur in any of the toes. Toe fractures cause significant pain, bruising, swelling, difficulty moving the toes, and trouble bearing weight on the toes when standing or walking. /r/n/r/n corns and calluses, thickened areas of skin, such as corns and calluses, develop from repeated friction or pressure. Corns are small and hard, typically over bony parts of the foot, while calluses are larger, tougher patches of skin. /r/n/r/n blisters, fluid-filled blisters form when pressure builds up under the skin. They often appear due to poorly fitting shoes, prolonged walking, or walking barefoot and can cause pain when standing or walking. /r/n/r/n ingrown toenails. This painful issue happens when the edges or corners of the toenails grow into the skin next to the nails. Cutting your toenail improperly, nail deformities, and ill-fitting footwear increase the chances of developing an ingrown toenail. Ingrown toenails can cause redness, swelling, pain, and sometimes bleeding and infections. /r/n/r/n toenail infection. Toenail infections, also known as onychomycosis, fungal infection, or paronychia, bacterial infection, can lead to pain, swelling, and redness around the affected toenail. If left untreated, the infection can spread, causing further discomfort and potentially affecting the surrounding tissue. /r/n/r/n vitamin deficiencies. Vitamin B12 and vitamin D are essential for bone and nerve health. Deficiencies in either can cause numbness and tingling, muscle and bone pain, and increased pain sensitivity, which may involve the toes. /r/n/r/n chronic problems that can lead to toe pain include, /r/n/r/n osteoarthritis. This degenerative joint disease causes pain, stiffness, and inflammation in joints due to the breakdown of cartilage. It can affect any joint, but when it affects the toe, it's called hallux rigidus. The pain develops gradually over time, often worsened by aging or an injury. /r/n/r/n rheumatoid arthritis. This autoimmune disease can cause toe pain due to inflammation and joint damage in the feet. Over time, this can lead to swelling, stiffness, and deformities in the toe joints, making walking painful. /r/n/r/n Raynaud's phenomenon, reduced blood flow to the toes, often triggered by cold or stress, is a hallmark of Raynaud's disease. This condition can cause numbness, pain, and noticeable color changes in the affected areas. /r/n/r/n Morton's neuroma, a thickened nerve between the toes, often caused by pressure or irritation, can lead to Morton's neuroma. This condition typically causes pain, burning, numbness, or the feeling of a lump in the ball of the foot. /r/n/r/n Tarsal tunnel syndrome. When the tibial nerve in the ankle becomes compressed or irritated, it can lead to tarsal tunnel syndrome, causing pain, numbness, and tingling in the foot. This nerve compression can also radiate pain to the toes, resulting in discomfort and sensitivity. /r/n/r/n Gout. Gout is an inflammatory arthritis caused by high levels of uric acid in the body, leading to crystal deposits in the joints. This condition causes pain, redness, and swelling, especially in the big toe, and can be triggered by eating foods like shellfish and alcohol. /r/n/r/n Sesamoiditis. Sesamoid bones are small bones in tendons that aid movement, with two located near the big toe joint in the tendon that bends the toe. Sesamoiditis occurs when these bones become painful and swollen, often due to pressure from activities like running or jumping. Risk factors include poor footwear or foot problems like flat feet. /r/n/r/n Bunion. A bunion is a deformity at the base of the big toe that causes the toe to point inward and the joint to jut out. Bunions are most often caused by wearing tight shoes that compress the toes. Bunions can be painful, and the altered alignment of the big toe joint can make walking uncomfortable. /r/n/r/n Claw and hammer toes. Claw toes and hammer toes are toe problems that cause pain. Claw toes bend at two joints, making the toes curl downward, while hammer toes bend at just one joint, causing the toe to look like a hammer. These issues are more common in adults, especially those with bunions, arthritis, or past foot injuries. /r/n/r/n Dactylitis. Swelling in the fingers or toes that creates a sausage-like appearance is known as dactylitis, often associated with psoriatic arthritis, an autoimmune condition that affects people with psoriasis. It causes redness, swelling, and pain in affected toes or fingers. /r/n/r/n Peripheral neuropathy. Conditions like diabetes, kidney disease, liver disease, and chemotherapy can cause nerve damage or peripheral neuropathy. This can result in pain, tingling, or limited mobility in the toes, particularly when standing or walking. /r/n/r/n Sharp toe pain can be caused by conditions like gout, where uric acid crystals accumulate in the joints, or by injuries such as fractures or sprains. It can also result from nerve-related issues like Morton's neuroma, where a nerve in the foot becomes irritated. /r/n/r/n Toe pain is not a typical symptom or warning sign of heart disease. However, it can occasionally be linked to /r/n/r/n if you have a history of high cholesterol, high blood pressure, or other heart conditions and develop new pain. Inform your healthcare provider. /r/n/r/n For people who have never been diagnosed with a heart problem, other signs of heart disease to look out for include /r/n/r/n If toe pain is your only symptom and you've never been diagnosed with a heart condition, the pain is unlikely to be heart-related. That said, if you're concerned, it's always a good idea to consult a healthcare provider. /r/n/r/n Minor issues that can cause toe pain, especially if you were walking for a long time and or wearing tight or uncomfortable shoes, typically resolve in a few days with rest. /r/n/r/n If your toe pain persists longer than a week, contact your healthcare provider. They can determine the underlying cause and help you get started with the appropriate treatment. /r/n/r/n Certain signs and symptoms indicate you need to schedule a visit to see a healthcare provider. /r/n/r/n If you experience toe pain after an injury, see a healthcare provider promptly for an evaluation. Proper treatment may be necessary to ensure the injury heals correctly. /r/n/r/n treatment options for toe pain vary depending on the cause and severity of your symptoms. Many causes of toe pain can be managed conservatively with medication and at-home treatments, but surgery might be needed for serious or chronic injuries. /r/n/r/n treatment options may include /r/n/r/n basic pain relief. At-home methods for toe pain relief include icing, warm compresses, topical pain creams, and resting the toe. Over-the-counter medications like ibuprofen, Advil, or naproxen, Aleve, can also help. /r/n/r/n gentle stretching. Gentle toe stretches can help maintain flexibility and relieve tightness and pressure in conditions like hammer toes, claw toes, Morton's neuroma, and sesamoiditis. These stretches may reduce discomfort and improve mobility in the affected areas. /r/n/r/n supportive footwear. Supportive footwear can help relieve pain and prevent further damage in conditions like bunions, hammer toes, and Morton's neuroma. Proper shoes with cushioning and arch support help reduce pressure on the toes and improve overall foot alignment. /r/n/r/n bandages or cushions. Conditions like corns, calluses, and bunions can benefit from bandages or cushions to reduce pressure and friction, providing relief during walking. These protective coverings help prevent further irritation and can ease pain caused by rubbing against shoes. /r/n/r/n splinting or immobilizing. Conditions like hammer toes, claw toes, sesamoiditis, fractures, and osteoarthritis can benefit from splinting or immobilizing to reduce movement, alleviate pain, and support proper alignment. For fractures, immobilization is crucial for healing, while for osteoarthritis, splints can help minimize joint stress and reduce pain. /r/n/r/n dietary changes. Reducing intake of foods high in purines, like red meat and shellfish, can lower uric acid levels and prevent gout flare-ups. For heart conditions, eating a heart-healthy diet low in saturated fats, salt, and cholesterol can improve circulation and reduce blood pressure. /r/n/r/n pain medications. Prescription strength pain medications like oxycodone or stronger non-steroidal anti-inflammatory drugs, NSAIDs, like meloxicam may be prescribed when over-the-counter pain medications do not provide adequate relief. /r/n/r/n condition-specific medications. If a systemic condition is causing your toe pain, your healthcare provider may prescribe medications like colchicine or allopurinol for gout, antibiotics for infections, ODMARDs and biologics for arthritis. /r/n/r/n surgery. Surgery may be considered for significant toe injuries or deformities that cause ongoing pain and affect your ability to walk, but it's typically only after other treatments have been tried. Conditions that may require surgery include severe toe fractures and ingrown toenails, severe turf toe, and sesamoiditis. /r/n/r/n physical therapy. Toe conditions like hammer toes, claw toes, and turf toe can benefit from physical therapy to improve flexibility, strength, and alignment in the affected joints. Physical therapy can also help alleviate pain and prevent further damage by teaching proper foot mechanics and exercises to restore normal function. /r/n/r/n most causes of toe pain can be effectively treated, and with proper care, the pain usually improves. However, recovery time may vary depending on the cause and treatment, so if the pain is severe or persistent, seeing a healthcare provider is recommended. /r/n/r/n toe pain can result from a variety of causes, including osteoarthritis, gout, turf toe, bunions, ingrown toenails, fractures, sesamoiditis, dactylitis, claw and hammer toes, peripheral neuropathy, and corns, calluses, and blisters. /r/n/r/n While most causes of toe pain can be addressed with at-home treatments and over-the-counter pain medication, some severe or ongoing causes of toe pain may require surgery to correct the alignment of your toe joint to relieve your pain. r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.